She figured out over time that he must have a posterior tongue tie, but sometimes doubted her knowledge and instincts. I felt way over my head. She was holding out to see a pediatric oral plastic surgeon, but no one would give her the referral. In the meantime, while watching him latch, she realized that he would pull back on the nipple because he couldn't flange his lips. Elijah was 7 months old when she discovered his significant lip tie. During this time, Leanne would try to wean off the domperidone. She was concerned about the way it changes the composition of breast milk, and she didn't think she would be able to get another refill. She knew she could make enough milk for her baby if he could transfer it, but every time she cut back, Elijah's weight would tank. Having introduced complementary foods, Elijah loved it, but food just came out again after getting pushed around his mouth a bit. He wasn't actually swallowing much of anything. We went together to the feeding and swallowing clinic, but they had no ability to assess breastfeeding. The only solution they could offer was to stop breastfeeding and thicken feeds in the bottle. Back at one of the lactation consultant offices, she was told again to just stop trying to breastfeed and exclusively pump for him. Anyone who's pumped knows how much work this is. She was also told to strap him in his high chair and make him stay, so he learned to eat when it was eating time, and only offer to nurse when it was nursing time, and never let him nurse outside of that. Because apparently feeding him less was going to help him grow. This lactation consultant did understand the implication of the lip tie, and finally, after many previous requests, referred Elijah to a pediatric oral plastic surgeon at 10 months. The surgeon, when she finally did get in to see him, didn't believe that tongue ties or lip ties caused any feeding difficulties, and that's understandable given the CPS statement, and refused to do an oral assessment. He was willing to take care of the lip tie under a general anesthetic, but he was very explicit that he was not doing it for breastfeeding. He would do it, but only because it would cause later dental issues, and the waiting list for an OR was 4 months long. By this time, she knew about Dr. Cotlow, and she showed him his research. He dismissed it because there are no double-blind randomized controlled trials. If we waited for double-blind randomized controlled trials to do anything in the medical world, we would do very little. The intern asked, "How long are you planning to breastfeed anyway?" Thinking she was probably going to be done soon. She was fed up and booked her appointment with Dr. Cotlow in Albany and her flight to New York. The trip cost about $3,000. Her private medical insurance didn't cover it. We were all very trepidatious before they took the trip. Would this be it? Would it make a difference? Would it make enough of a difference? After almost a year of struggle, hours and hours of appointments, huge dollars spent in our medical system, would this finally be the answer? She called me right away from the hotel room. Immediately after the procedure, he was nursing completely differently. They went for lunch across the street, and he ate his lunch easily without it falling out of his mouth. When she came back to Edmonton, we met at the indoor soccer center, of all places. My kids had a game, and we went into the bathroom, which for us is pretty funny and ironic to go and nurse in a bathroom. But in the bathroom, we had some privacy, so I could actually take a really good look at her breast while he was nursing, which would look kind of odd in the crowds. The first thing I noticed was that he asked to nurse, and he self-attached. Totally different behavior from the week before, where she was constantly having to coax him to the breast. I was absolutely astonished with how different his latch was, and I could see him swallowing immediately. I was blown away by how totally obvious the differences were. Even his smile had changed. In the weeks that followed, I also saw him fall asleep milk drunk at the breast, something I had never seen him do in his whole life. Elijah started gaining weight very quickly, much more than a normal busy 11-month-old would be gaining. He would still lose weight when he got sick, but he would pack it back on when he got better in a way he never could before his revision. And most importantly, he would actively nurse while sick, something he'd refused to do since he was tiny. Finally, almost a year after he was born, Elijah and Leanne had a normal breastfeeding relationship. But the ripple effects of that year are still being felt as Elijah plays catch-up and the whole family recovers from the intense emotional roller coaster they had to endure. Through Leanne's experience and many others since then, I've realized that my own children are tongue-tied, and that the slow and even stalled weight gain that my 4 boys experienced was likely due to this. As was the pain I experienced throughout my 12 years of nursing, which I attributed to being fair-skinned. 2 of my sons had speech delays, and one of them was quite late on meeting developmental milestones. He also refused solids until he was over a year and a half, lost excessive weight after birth, and was a very anxious, and now I realize hungry, baby. He's also the one whose molars started rotting away last year, and he's the one with the most significant posterior tie. It's been both a revelation and deeply upsetting for me to finally understand what was wrong, and also how simple it would have been to fix. Leanne was the first mother from Edmonton that we know of to travel to Albany to see Dr. Hollow, but she was not the last. We are very grateful that he's able to come and present this weekend, so we can begin to build the desperately needed support and expertise here in the Canadian Prairies. I'm now going to ask Joanna Johnson to come, and she's going to tell you her story.